Hello, my name is Aaron Menenti of St. George's University, and I wanted to take a few moments today to discuss an important zoonosis, swine influenza virus. To start off with a little background information, this is a disease commonly referred to as swine flu and has a handful of strains known to infect humans, most commonly of which is H1N1. It is a respiratory disease caused by influenza A that regularly occurs in pigs. Among swine herds, it generally causes mild symptoms that can circulate throughout the year. However, similar to seasonal human influenza, outbreaks more commonly occur in the fall and winter months. It is a variant virus, meaning that it is common to pigs, but does not usually circulate to humans. Strains of the virus that are detected in humans are thereby referred to as variants. My interest in swine influenza stems from the 2009 pandemic, as this correlated to the start of my medical study and affected several people close to me. It is a public health concern given human susceptibility to multiple variant influenza strains that make it possible for mixing of genes between viruses and the creation of a new virus. This is what occurred with the 2009 pandemic. Prior to that time, there were few known cases of swine flu. However, during the pandemic from 2009 to 2010, H1N1 was confirmed to be present in at least 214 countries and estimated to cost between 150,000 and 500,000 deaths. In terms of transmission, swine flu is transmitted via droplets or transfer from contaminated surfaces. It is passed to humans through direct contact with pigs, for example, at fairs or workers in swine production. It is also transmissible through environments previously containing swine. However, it is not known to be transmitted through pork consumption. The signs and symptoms of swine influenza are similar to those observed in regular seasonal flu and include fever and chills, body aches, fatigue, cough, decreased appetite, runny nose, sore throat, trouble breathing, eye watering or irritation, headache, nausea, vomiting, and diarrhea. According to CDC guidelines, clinical diagnosis of swine flu is made in the presence of the following. A person who experiences acute fever and upper respiratory infection within 7 days of close contact with a person who has a confirmed case of H1N1 or has traveled to a community where there has been at least one confirmed case of H1N1, or they live in a community with at least one confirmed case of H1N1. Diagnosis is typically confirmed using nasal or throat samples, and these tests are at the greatest sensitivity within the first 4 to 5 days of infection, as this is the most infectious period for the virus. Other tests, such as blood work and chest x-rays, can help rule out other diseases and complications and further lead to swine influenza A diagnosis. The people at highest risk for infection and complications from the virus include those hospitalized or residing in a nursing home or other long-term care facility, children, especially under the age of 2, people over the age of 65, pregnant women, the morbidly obese, people with certain chronic conditions or weakened immune systems, and people of American Indian or Native Alaskan descent. Prevention strategies exist for transmission between pigs, from pigs to humans, as well as for human-to-human transmission. Strategies for prevention among pigs include controlling access of people, animals, birds, and transport, testing of incoming stock, proper disinfection and hygiene systems, and different segregation techniques. For pig-to-human transmission, it is recommended to attempt to minimize contact with pigs and take protective measures whenever in contact, including wearing proper clothing and equipment, washing hands before and after any contact, and avoiding any hand-to-mouth contact when in an environment with pigs, as well as vaccinations for individuals with frequent contact to swine. With regard to person-to-person transmission, recommendations are similar to those of seasonal flu. So staying home when ill, frequent hand washing, containing coughs and sneezes, avoiding crowding areas when possible, and vaccination. As for case management, when swine influenza is acquired, complications can arise, particularly for those at high risk, but generally most cases require only symptom relief, such as rest, fluid hydration, and the use of pain relievers as needed. When the virus is detected within the first couple of days of onset, antiviral medications are commonly prescribed, but the virus is usually shed within 10 days. So that brings us to the conclusion of this presentation. I hope I was able to spread some awareness regarding swine influenza and would just like to thank you for your time.